Hi, I'm Sabrina Hauser, and I'm presenting this paper published at the ACM CHI 2020 conference on behalf of my author team. We describe the design and deployment of Calmer, which is an actuated platform device placed in an incubator administering breathing motion, heartbeat sounds, and skin-like tactility to simulate maternal skin-to-skin holding to a prematurely born infant lying on it. We report and reflect on our 10-year design path of creating this technology. We detail what motivated us to design this device, give insight into our approach, go into details about the physical design and its iterations, and also describe how we introduced it into the Neonatal Intensive Care Unit, the NICU. We present findings from testing Calmer in a pilot deployment, a randomized clinical trial to demonstrate efficacy, and a qualitative interview study. As we report and reflect on our work, we extract key takeaways from our approach to designing Calmer, carefully considering the socially and technologically complex context. With this in mind, I'd like to directly point to how the Calmer project offers a unique design case to the HCI community. Calmer is an exemplar of replicating an intimate human behavior and moment that is at the core essence of what it means to be human. It seems nearly unreplicable. A mother holding her prematurely born fragile infant, the infant experiencing the warmth, the breathing, and the heartbeat of the mother. Yet looking at Calmer, we wouldn't assume that, but instead we see a plastic platform. The long-term persistent engagement over 10 years to designing this technology resembles a strategy that includes cautiously and well-considered contextual, social, and medical ecological needs of the various stakeholders and their situations. This includes the premature infants, parents, and medical staff. A considerable focus in our work became the objective of replicating, yet importantly not replacing, maternal holding, an intimate human action and practice offered at a time of fear, hope, life or death, and with challenges around significant maternal stress. Calmer contributes to HCI strategies to designing for the NICU and broader hospital context, to conscious and empathic automation of human actions, and to design-led research targeting product development in a vital context. In the remainder of this presentation, I will highlight some of the main parts of our paper. Specifically, I will speak about the clinical background and context, give highlights of the design iterations and evaluations, and then discuss some of the key takeaways. There's a lot of nuance and details in the paper, and this will only be a glimpse of that. Each year worldwide, over 15 million infants are born preterm. Separated physically from their mother to ensure their survival, these infants can remain in the NICU for weeks to months, repeatedly undergoing essential but painful care-related procedures such as blood tests. Some infants may be subjected to up to 15 painful procedures like that a day. This early stress has severe effects on neonates. It can induce long-term damage to many developing systems, and it can also have damaging effects on parents. Pharmaceutical medications have limited efficacy for procedure-related pain in premature infants, and so instead, maternal skin-to-skin holding is recommended as a powerful alternative. When a mother holds her infant on her chest where it experiences the touch and warmth of her skin, the sound of her heartbeat and breathing motion of her chest, as much as 50% of pain can be reduced. The components of skin-to-skin holding simultaneously activate multiple opioid and non-opioid pathways to reduce pain. However, parents cannot always be at bedside. They may have competing responsibilities, or their infant may receive care far away from home. And yet, even when parents are present, there are still further barriers to skin-to-skin holding. For example, infants may be too medically unstable to be held and instead have to stay in the incubator. An alternative being used in some NICUs is facilitated tucking, a human touch-based holding strategy. However, this strategy can be hard for busy NICU staff to provide for every procedure. And this is where our project team of clinicians and researchers saw a potentially high-impact design opportunity in physically simulating key aspects of maternal skin-to-skin holding for premature infants when a parent is not present. In what follows, I'll speak briefly to the initiation of the project, detail our guiding objectives and requirements, and report on Calmer's design stages along with the different ways we deployed and studied 2 Calmer prototypes. The Calmer project came about through a serendipitous encounter of a neonatal pain researcher who was also a former NICU occupational therapist and a haptics human-robot interaction researcher. It was inspired by furry breathing robots, part of an effective computing and robotics project. We talk more about this in the paper. From the start, the primary goal of the Calmer project has been to design and build a device that reduces pain in preterm infants by simulating key aspects of maternal skin-to-skin holding, and as a result, potentially alter the standard of care in neonatal pain therapy. Importantly, part of this goal has been to consider a conscious and careful integration with the technological and social complexities of the NICU environment. 3 core design objectives were developed aligning with this main goal. The technology we wanted to design had to conform to the needs and practices of multiple users and stakeholders. Although the experience of maternal holding is targeted at infants, our prototypes had to work for parents and NICU staff as well. We knew that it would be unacceptable for this technology to be perceived as replacing parents. Not only could it be rejected by parents, but also staff because of the strong philosophical approach in NICUs promoting family-centered care. For instance, in light of this objective, we realized we had to diffuse the appearance of life-asserting cues, yet still provide them to the infant. We also knew a medical technology concept like Calmer could not proceed without clinical validation. So it was important for us to work towards an eventual randomized clinical trial. With these objectives, a first prototype was developed to explore and demonstrate the feasibility of our developing concept with limited resources. Our approach was to simulate putative pain-mitigating components of maternal skin-to-skin holding through the modalities of breathing motion, heartbeat sound, and skin touch, using tactile, auditory, and kinesthetic stimuli. This defined 4 technical subsystems. In this first prototype, we also explored the option of Calmer using an individual mother's breathing and heart rate. This kind of personalization was something we wanted to explore as a form of integrating mothers into the technology that was simulating them. It ended up being a quite powerful move towards avoiding mothers feeling replaced. All components were hygienic and cleanable to NICU standards. While we did not expect this prototype to support a clinical efficacy trial, we wanted to assess our design and engineering approach and get a sense of how infants, parents, and staff would respond to it. For that, we conducted an initial randomized pilot evaluation on 10 infants using Calmer for pain reduction during a single medically necessary blood test. We share more details on this study in our paper, and there's also a medical paper published with our results. While the sample was too small to statistically determine efficacy, the data was encouraging, and this was an important step to the project's future and to secure further funding that would support a more sophisticated prototype iteration in a larger clinical trial. For this next move, we generated a list of desired improvements from staff and feedback and our own perspective, and we guided a professional engineering team in developing the second prototype over the course of 18 months. With the goal of conducting a larger clinical trial, the second iteration on Calmer demanded greater NICU operability. We needed to maintain infants on the device for longer periods of time, and that in turn led to many new requirements and changes. We had to change the power source for better flexibility and mobility. All materials had to be X-ray compatible. The skin simulating covering was exchanged to improve infant comfort and mobility and to have less of a skin tone color. A custom controller for more compact and streamlined access was developed, and an emergency stop button added to allow for performing CPR on an infant. And a series of tests were done to confirm the prototype could meet robustness requirements. With the new device, we ran a single-site randomized clinical trial with 49 infants to determine Calmer's efficacy. The trial showed that Calmer was as effective as facilitated tucking for reducing pain during a single blood test, and hence a viable alternative. These positive results led to 2 granted patents, and our hope is that the Calmer technology will eventually be implemented in incubator designs worldwide. Again, we share more details on this study in the paper, and there's also another medical paper published reporting on the trial results. In addition to studying Calmer's efficacy, we wanted to examine its acceptability and the user experience from the perspective of both NICU staff and parents, and investigate how well it catered to the social complexities and context of the NICU. We addressed this objective with a qualitative study conducted in parallel with the clinical trial. We interviewed 10 mothers of preterm infants who experienced Calmer in our clinical trial and 10 NICU staff who cared for them. We looked at the fit of Calmer in the NICU and their perceptions and experience of it. Staff reported that Calmer was not perceived as an obstacle in their work. Mothers reported appreciation of Calmer's mimicking features, its potential to strengthen the infant-mother bond, and that they perceived it as looking like a discreet, non-threatening bed. This was really positive because they didn't perceive it as a replacement, but rather as a backup. And this positive experience and perception of Calmer by staff and parents was extremely important to the success of this technology design. To give you a brief glimpse of the kind of takeaways we discuss in our paper, I will touch on those now. We believe the background and circumstances in our project mattered. The way the project came about initially was remarkably defining, as the main idea developed from that initial serendipitous encounter and the two different experts joining forces. Access and iterative design based on feedback on prototypes was impractical, nearly impossible, due to the challenging context and environment in this project, which had to be treated with extreme caution. Various workarounds had to be developed. For instance, we capitalized on team members' diverse expertise and multidisciplinary experiences. Stakeholder input was often covered by our own team. With Calmer, the premature infant experiences the haptics features somewhat passively, with our design feedback being metrics on pain reduction. At the same time, others, in particular parents and NICU staff, experience the device interface more actively in a social or workflow sense, yet they do not experience the haptic features. This was a challenge unique to this project, as typically the person one is designing for would be the person who would feel and interact with the haptic features being built. A key part of the objectives in designing Calmer was to replicate maternal skin-to-skin holding in a conscious, empathic, and integrative way. The surprise to us was that the small symbolic gesture of using a mother's individual heart and breathing rate programmed into Calmer when her infant was lying on it was so powerful. This act of sampling made mothers feel supported, even channeled through Calmer rather than supplanted. Although Calmer was perceived as a welcome backup of mothers rather than provoking uncanny feelings, we would not argue that deliberately mimicking pieces of a human, even if done carefully as we did in Calmer, always has a place. As I mentioned at the beginning of this presentation, Calmer is emblematic of its strategy and features and presents a unique design case to the HCI community. The project reports on a long-term process of designing in a complicated space, considering the conscious and empathic automation of human action. The Calmer project can inform further work and discussions in haptics research, in automating or replicating human actions, as well as design work for the NICU and broader hospital context. Our work also shows how research through design can play an important role in a vital context. Calmer is a research through design exemplar of an innovation targeting commercialization, and we continue to work with this aspiration. This project is ongoing, and we are working on a third version of Calmer and future studies. Thank you for watching, and we'd also like to thank our funding bodies, our review chairs and reviewers, and the awards committee for honoring our work with a Best Paper Award. Please go to the ACM Digital Library and read our full paper and reach out to us if you wish.